All right, let's talk stress management. So, death and dying, fire, injury, illness. Turns out EMS is stressful and you signed up for it. In fact, you paid for school so you can get involved in it. Crazy, right? But this is what we do. So, it's a high stress job and you know that going into it. So, you want to make sure that you're getting prepared to deal with the stress. This is going to talk about some of the things we talked about earlier in nutrition, in exercise, in sleep, in having those outside relationships, and also preparation and being prepared for the call with your studies and your skills. There's a thing called general adaptation syndrome, and I promise you, you'll see this again. And there's 3 stages to this general adaptation syndrome. That's going to be your alarm response to stress, reaction and resistance to stress, and then our recovery or exhaustion from stress. So let's unpack that just a little bit. The alarm response to stress. This is when your body kicks in. We're talking fight or flight, or possibly freezing up. Your body's going to do something. If you're prepared, if you've been getting ready for these scenes, you're going to be able to respond a little quicker, even if you get thrown off. But some stuff is just new, so you can recognize or just know in advance that your body might want to lock up. This is going to be a reaction to the stress. So be prepared for that. Just going through your studies, leaning into your partner, get yourself going so you can continue on in the call. So this is going to be the alarm response to stress, whether that's positive or negative, go time or freeze. There's going to be an alarm to this stress. Next, reaction and resistance to stress. So once that stress comes in, are you going to start thinking too fast? Are you going to start thinking too slow? And also the resistance to stress. I don't like what's going on, but I have to function. This is what helps me on those calls. When I start to see myself get locked up, I think to myself, this is what's happening right now. Love it, hate it, doesn't matter. This is what's happening right now. So I can either function or not. And now I'm just going to do the best I can in a bad situation. And so that helps me with both my reaction and resistance. It helps me to keep going. Another thing that's great for your resistance is just relying on your training and being ready. So, hey, what do I do next? I'm not sure. Well, do I remember the last thing I did? Okay, I'm going to go from there. And so this is going to help you resist that stress from freezing up. And last but not least of our general adaptation syndrome is going to be recovery and or exhaustion from stress. After the call is over, a lot of times there's that adrenaline and there's that chemical dump. You can be worn out. And so you need to be able to recover, whether it's having that meal you like, some exercise, a book, talking about it with your partner or a trusted outside source, somebody that's going to provide some counseling to you. You're going to need to process it. Earlier on, I said that there's tools in a toolbox. And sometimes you need a plumber because you don't have a pipe wrench that big. Well, sometimes you don't have the tools to work through what just happened and unbox these thoughts. That's when you go get a different tool from your toolbox and you ask for help from a counselor or somewhere else. There's resources available to you. And this is part of your recovery. Because remember, you got through that moment, but the next call is coming. And so that's the job. We need to be ready for that next call because they're calling for help and that one might not have gone well, or maybe it went great, but you got another one coming. So you need to learn those techniques to build yourself up. So general adaptation syndrome, alarm, reaction, and recovery. So now I'm going to read these ones to you straight out of the book. Common sense, but I want you to hear them, I want you to read them, and I want you to be ready to recognize them both on scene, in you and your partners, and then also in your exams. So physiologic manifestations of stress. Here we go. Increased respirations and heart rate. Think fight or flight. Everything is accelerating. Increased blood pressure. Fight or flight, right? You're getting ready for go time. Dilated venous vessels near the skin surface. So that's going to cause you to be cool, clammy skin. So you're getting some dilated veins so you can get that blood returned back. And so you can get that circulation going to get the adrenaline cruising through that body. Then we're going to have dilated pupils, tensed muscles, increased blood glucose levels. So your body releases some of those sugar stores so you can have the energy to function. Perspiration, you're going to start some of that sweating, and decreased blood flow to a gastrointestinal tract. Basically what that means is when you're getting ready to be in that fist fight or in that emergency, digesting that sandwich is no longer a major priority, right? So you're going to have the sympathetic response, which we'll get into later chapters, versus the parasympathetic response. You're going to hit the gas in your body so you can go. Not necessarily breaks where you need to take a nap and digest that sandwich. So fight or flight or rest and digest is your parasympathetic. Fight or flight is your sympathetic. That's going to be increasing the gas. This is going to be those physiologic manifestations of stress. All right, so situations that are stressful for EMS providers, dangerous situations, physical and psychological demands. You're getting called into bad situations. You're getting called where people are hurt, in danger, sick, a lot of different things we show up to. And so any of these can be dangerous to us and also stressful. There's even smells and sights and sounds that just, they'll stick with you. You'll show up and there's just all that noise, the breaking glass, the crying, the hurting, they can really stick with you. And certain illnesses, they got a smell to them. And some of that stuff you don't forget, but on scene, you can't let it distract you. You got to get your mind and your body ready, part of that alarm response that we were talking about earlier, so that you can function on scene and also recover. Also, if there's multiple patients, even if it seems like maybe small injuries, if you got 2 or 3 people, it is very easy to get overwhelmed. Have you ever tried to talk to 2 or 3 kids at the same time? That's stressful, right? Just imagine if everybody's sick or injured. That multitasking can be really difficult and you can get overwhelmed fast. Even 2 or 3 patients is almost a multi-casualty incident, depending on the resources on scene. So just know that's going to be a stressful environment. Also, angry people. I remember we went on a call for a kid and he had a head injury, and his dad was, he's in some of the medical field and in the military, and he was having a hard time with what was going on, and he was basically cussing us out in the back of the ambulance because we were trying to start an IV. And it was hard, but he was concerned about his kid, right? It wasn't a matter of me wanting to yell back at him or it's time to assert myself. His kid was sick. This was a difficult situation. And so sometimes you just got to be prepared to get yelled at or mistreated. There's a limit, and when it hits that limit, now we're going back to scene safety, and you might need to pull out, but you might deal with some angry patients. And also unpredictability in the demands of EMS. You might not even be done with your first call. You might still be cleaning your ambulance and dispatch this call and say, we need you right now. Well, you're not in service yet. You got to finish cleaning up, but you've already got that demand. Those back-to-back calls can be exhausting. And so there's some unpredictability and high demands in the field. So let's talk about stress reactions. And we'll start with acute stress reactions. And acute doesn't mean it's a pretty injury, right? It means that it's happening right now. Acute is it's happening right now. Chronic is this has been going on. So acute stress reactions, this occurs during our stressful situations where, let's say you walk into a basketball game and now it's going on and that heart rate starts going up and you're excited because you're there. It's happening right there. You can have some delayed stress reactions. And so I know I get these after I've been through a lot of stressful situations. About the next day or so, I'm just tired. It's like the stress caught up with me all at once. I used all my energy and now I'm just ready for a nap. I'm having a hard time moving forward. And that's going to be an example of a delayed stress reaction. We can also have cumulative stress reactions. And this is when it kind of builds up over time. Have you ever been around friends or family and you're like, they had a rough week, they're just really stressed out? This is kind of that cumulative stress reaction. So some of the things you might see with this, it's building up. So look for it in you and your partners, because we're looking out for each other, right? We spend a lot of time with each other in that rig and at the station. So be looking out for these signs. So fatigue, we talked about that for me. Changes in appetite. Maybe they're insatiable. They just can't stop eating. They're doing that stress eating, or they're just not hungry. They just don't have an appetite. Gastrointestinal problems. They're getting stomach cramps a lot, or they're having bad bowel movements, or they're feeling nauseous a lot. Just something is changing in their GI. You can also have some headaches, insomnia or hypersomnia. So maybe you're just exhausted or you just can't sleep. These are going to be some warning signs. Inability to concentrate and irritability. They just can't focus on what they're doing. Maybe they're blanking out, or maybe they're completely distracted, or this is a sign of cumulative stress. Something's building up and your mind is having a hard time functioning in the moment. We can also deal with hyperactivity or underactivity. Just, hey, you know what? The best way to deal with this is to clean the kitchen. And I just can't stop. I'm just going to go. Or it's like, you know what? Forget everything. I'm just going to sit here and stare at the wall. Both underactivity and overactivity are both examples of this cumulative stress reactions. Now, we can also have some psychological symptoms. And so these are those things that we carry with us and are running through our mind. And these are things like fear. When is that call going to happen again? Is that going to happen to me? When is that call going to show up that I'm not ready for? It's these psychological thoughts that are going on and are attacking our minds. We can also have dull or non-responsive behavior. All of a sudden, things don't matter as much anymore. You're just very flat and things have lost importance. Another one would be depression. You can be feeling really low, really sad, just hard to function because of the things you've seen or maybe the things you've had to be a part of. You can also have guilt. I could have done more. I should have done this. I should have done that. These are some more thoughts and reactions to stress, trying to make sense out of some. Another one would be depression. You can be feeling really low, really sad, just hard to function because of the things you've seen or maybe the things you've had to be a part of. You can also have guilt. I could have done more. I should have done this. I should have done that. These are some more thoughts and reactions to stress, trying to make sense out of something that maybe you just can't make sense of. Some stuff is just a bad day. Things happen in this field. Bad things are going to happen, but we're showing up to do the best that we can. And so we need to try to be ready and avoid that guilt. And then oversensitivity. Somebody says something and you're just lit, right? You're playing pickleball and somebody says that one thing when you're playing bad and you just throw your paddle, right? Just fling that thing or you kick the basketball, whatever sport you're in. There's just a hypersensitivity or an anger and irritability or easily frustrated. Look for those in your partner, and you probably want to look very hard because when they're being snotty to you, you kind of know, like, bro, what's your problem? Stressed? But act like you care, right? Lean in. All right, so now let's talk about post-traumatic stress disorder. There's a lot of things we've heard about this. There's a lot of things we've seen, and this is PTSD, post-traumatic stress disorder. And this can develop after a highly stressful or a psychologically distressing situation. The mind, the body had to go through something very, very abnormal. And now that stimulus, if you come across anything like it, puts you right back in it. It's like your body remembers what was going on. And so when you get that smell, you get that sight, you get that feeling, all of a sudden you're back in that situation. And it doesn't mean you're having flashbacks, but it might mean I don't know why my heart is racing and I feel like I'm going to have a panic attack. I'm just standing in line at Starbucks, right? Well, I mean, after Starbucks, you might have a racing heart rate, but you know what I'm saying? It's like something is triggered and my body is just responding. It doesn't have to be a flashback, although it can be. You can hear things, you can smell things that might not even be there, but that is all instigated by something. And so this is re-experiencing events based off of a stimulus. And this is an example of post-traumatic stress disorder. Now, in order to combat this, we have things called like a CISM, or a critical incident stress management. And what this is going to be some professionals that come in after these calls, and sometimes even a critical incident stress debrief right after the call, sometimes even right on scene, where you start to process what's going on. You talk to somebody, you share your feelings, you share your sights and your sounds. And this isn't meant to be judgmental. It's pretty much meant to say like, hey, this was messed up. And if it's affecting you, that's to be expected. You're not weird because you're hurting. You're not weird because you're bothered. Let's work these things out together. And sometimes when you don't feel like you're abnormal or alone, that can make all the difference. And sometimes talking to somebody that has been there before can give you that hope to know that there's something on the other side of this. And so this is going to be our critical incident stress management or our critical incident stress debriefing. It can happen right when it's on scene. Let me see. And I think it can also happen within 24 to 72 hours afterwards. Sometimes they'll even bring in counselors to help you walk through those things. And so this is your critical incident stress debrief. Don't be afraid of them. And if you need it, call for it. If you think other people are being affected, call for it because we're looking out for each other. All right, the next one we're going to talk about is burnout. So burnout, man, you're just exhausted, you're cynical, you're just over it, you're tired of it. I'm tired of going to this address. You're just burned out. This happens in EMS. We show up to a lot of bad situations, and sometimes they're similar over and over and over, and sometimes it's the same person, and it can get frustrating. That is a good sign that you maybe need to switch shifts, or you need to go to a different station, or take some vacation time, or stop watching EMS videos on YouTube. Maybe take a break and do something else, right? Take your wife or your daughter or your husband, whatever, out to dinner. Do something that's going to be different outside of the field. You've got to be filled up in other ways because you're burned out at work. That is a draw for you. And so you need to find a way to pull things in. Burnout is a real thing. So long-term stress adds up. So let's talk about compassion fatigue. This is when that good bedside manner is not there. You're tired of being concerned. You've talked to this diabetic patient who has done this 5 times. And now you're like, bro, I'm tired of waking up at midnight. It seems like you don't care anymore. This can manifest into relationships with people at work, when you're in the ambulance, when you're in the fire engine, when you're in the station. They can be, you're very cynical at home, but just the caring isn't there anymore. It's like you used it all up. It's time for a vacation. It's time for a change of scenery. Back off on the overtime, right? Do some things you enjoy. Read a book. Find a way to get filled back up. You're getting called into people's worst days. It's a very, very special thing. Now, another thing that we just got to talk about real quickly is responder risk for suicide. We're taking all these things in, and it can be difficult to process. And so the emergency responders are not immune to suicide. So be looking for the signs and symptoms of this burnout, this compassion fatigue, those comments of wanting to hurt themselves, or just hopelessness, and ask the follow-on questions. I would rather offend my buddy than not ask the question and then be wondering afterwards why I didn't say something. Somebody asks me, I can just tell they care, right? So this is what we need to be aware of. Look for those signs and symptoms in yourself and in your partners. Or not. So we'll talk about emotional aspects of emergency care. Everybody gets upset. Everybody has a hard day. Just because you've been on the job for 20 years doesn't mean that you can handle anything and everything. You might do a little better with it than some people, but you've got 20 years of cumulative stress. And so these things can build up, and it can happen at any time. Every once in a while, you might just go on a call and you're not even sure why it affected you, but it's affecting you. And so we know that going in. This is normal for the field. I remember when I first got my medic license for the first year, I feel like I'm doing well, everything's fine. And then all of a sudden I'm thinking, is tonight the night I get the night, or is tonight the night I get the call that I'm not gonna be able to handle? And it was like this medic panic. That's a normal part of the job. You're going to get over it and move forward as you see and do more things and trust your partners. But the job is emotional. You show up on scene to be a professional, but remember, those emotions are going to come and they need to be processed. All right, so stressful situations. During stressful situations, you got to exercise extreme professionalism, because remember, everybody else is around you stressed also. And so fighting fire with fire typically makes a hotter fire. So when you're stressed, recognize other people are too. We're not living in a vacuum. And so we need to try to have some stress management and some grace for the other people in our life. They're probably not going to do it perfectly, and neither are you. So keep that in mind and show some grace. Now I'm going to read these ones directly to you because it's directly out of the textbook, and you'll probably see them again. And so these are factors that influence how a patient reacts to the stress of an EMS incident. You can never put your finger on all of it, but these are different things that can kind of lay out why they might respond the way they respond. So here we go. Socioeconomic background. Fear of medical personnel. They get that white coat syndrome. Alcohol or substance abuse disorders. History of chronic illness. Some people just might have those reoccurring issues, and that might not make sense, but that's kind of the nature of some of these mental illnesses that people can have. So mental illnesses, reaction to medication. Sometimes it's not them. That medication is altering them chemically and they're acting weird. Maybe it's a new medication, or maybe they took too much, whatever the case may be. But medication, this could affect the way people respond to you. Age, the very young, the very old, or in between, they can all respond fairly differently based off of their history. Nutritional status. I've read in books that the times you're most often going to act like a jerk is shout, right? Sick, hungry, angry, lonely, or tired. You're going to be more prone to acting like a jerk, okay? So nutrition status, that goes into hunger. We've all needed a Snickers bar, right? We've all seen those commercials. So feelings of guilt. They can be looking at, why did I do this? Or I was driving the car and somebody got hurt. That could be something they're struggling with. Or they're thinking back, almost like a PTSD, to another situation where they were carrying guilt. And also past experiences with illness or injuries. If you've ever hurt yourself the same way twice, you're already reliving how you had to recover after the old one. And we've seen it in plenty of pro athletes. That second time they get injured, or even after a major injury, they're thinking, am I going to be the same? And it's building that trust so they can function. Well, if you've been hurt once, it might be hard for that patient to want to see you again, because it's like, hey, I don't want to deal with this again. There's part of me in the back of my head that's thinking, like, don't tear your Achilles again. Wasn't a good experience. I don't recommend it. If you're thinking about pulling a tendon, consider something else. Well, anyways, that's chapter 2. Don't forget to like and subscribe, share with your friends, and go ahead and send me a message down below if there's something specific you want to see, because we're going to keep coming out with information and giving you what you need to know, quick, hard, and in a hurry. Thanks for watching.